distinguished guests, we face both challenges and opportunities today across the Americas. Ours is a region experiencing sustained economic growth and improved governance. Incomes are rising and middle-class populations are growing. Member states are making progress towards realizing the Millennium Development Goals. We are more integrated in the global economy and with multilateral institutions. Progress has been realized across a broad range of important health indicators. Infant mortality rates have declined. More children are protected through immunization. Life expectancy continues to rise. Investments have been made in development areas that directly impact human health, such as food security, nutrition, access to safe water and sanitation. Our member states have made bolder commitments and allocated greater resources to providing access to health services to all of their population. In addition, more people have access to information about their health and healthy living. They have more access to new technologies that educate them as well as those that can treat and cure them. And beyond just preventing and treating health conditions, we are also beginning to address important social and environmental determinants that directly impact human health. These conditions converge to create a unique moment for health in the Americas. We have a powerful potential for health to be a driving force for change. Nevertheless, our progress has not been experienced equally, and new challenges are emerging. For example, our demographics are changing. So even as we work to provide care so that every child and young adult can have the chance for a healthy, productive life, we also need to care for a larger and growing population of older adults. We must address the large and growing burden of non-communicable diseases. This includes cancer, diabetes, heart disease, and chronic respiratory illnesses. These are no longer just diseases of the rich. They constitute the leading causes of premature death and disability across our region. They also cause disproportionate suffering among lower income groups and contribute to the rising health costs. We also cannot ignore the quiet killers such as obesity, physical inactivity, tobacco consumption, and the harmful use of alcohol. These can be effectively reduced and treatment improved through utilizing the WHO Best Buys intervention. Public policies can help shape the way we live, work, and play, creating environments for healthier life choices. Investing in these interventions and mobilizing political support for their implementation will help people live longer and healthier. In addition, certain social and environmental determinants, factors such as where people live, where they are born, where they work, and where they age, also lead to health inequities. Many across the Americas have benefited from the region's sustained economic growth and rising income. But not all individuals, communities, and countries have progressed evenly. Poverty levels have declined, yes, over the past 3 decades. But today, there are still more than 150 million people in our region living in poverty. And more than half of those are living in extreme poverty. And this is the reality of our region. We must therefore continue to work to extend the benefits and possibilities of health throughout the Americas and in each of our countries. This means focusing our special attention on the most vulnerable and marginalized people, especially the poor. While their needs are greatest, their voices often go unheard. We must also overcome the barriers of health access for the indigenous communities, ethnic minorities, people with disabilities, women and children, older adults, among others. In our technical cooperation efforts, we will continue to prioritize action in the countries with greatest need. We recently marked the 3rd anniversary of the tragic earthquake that devastated the Haitian nation and the Haitian people. We will renew our commitment to working with the Haitian government and people, building capacity, and working with other partners to rebuild the country's health architecture and infrastructure. For me, of the many challenges that this organization and our member states face, one goal stands atop of all others. It is providing universal access to healthcare across the Americas. For indeed, good health is rooted in equity, universality, solidarity, and inclusiveness. There is no single or sure path towards such an achievement. Our member states are indeed diverse in size, resources, and levels of development. But I do believe there is common ground among us in at least 3 fundamental tenets of universal health coverage. First, it means that every individual and community has access to health services for prevention, promotion, treatment, and rehabilitation. Second, it means putting in place the financial mechanisms and policies that must ensure that people are protected from falling into poverty when they access health services. And third, universal healthcare means universal access to well-trained, motivated, well-distributed healthcare professionals, to safe, quality, and effective medical products and technologies, to well-organized delivery networks. In effect, it means building and maintaining strong health systems based on the primary healthcare approach. Our work in this must be guided by innovation, evidence-based information, and the appropriate research. The Americas has a long history of success in addressing communicable diseases. We have successfully taken on smallpox, polio, measles, and rubella. Our work continues today in global priority diseases, such as HIV/AIDS, tuberculosis, and malaria. We are also scaling up the fight against Chaga, dengue, onchocerciasis, and other neglected infectious diseases. We will need to develop and implement multi-sectoral approaches to address the complex determinants of these diseases. We must also work to improve alert and response mechanisms for extreme environmental events, natural disasters, and disease threats and epidemics. In this regard, I want to appeal to member states to accelerate action for ensuring that they meet the core capacities under the international health regulation. We will explore innovative strategies and flexible cooperation models to improve regional and national health capacities and ensure that all countries benefit from each other's advances and expertise. No individual, no institution, and no member state has all the knowledge, resources, or capability to do this alone. We need to seek and develop new partnerships to leverage the best ideas, share the most important knowledge, and adopt the most innovative approaches and practices. This may include our working with multilateral agencies, development banks, civil society, think tanks, academia, state-based organizations, professional associations, and the private sector. Ours must be an inclusive, shared agenda with collaborative partnerships that promote the development of national, regional, and cross-regional health architecture. I believe strongly in the whole concept of country ownership. If we are to make it a reality in the Americas, then all stakeholders must have a seat at the table where local and national health decisions are made. And all stakeholders must commit to the behavior change that will allow them to align and harmonize around national leadership. I wish today to invite everyone to participate in expanding this organization's global health diplomacy. We should also search for solutions beyond our hemisphere to learn from Europe, Asia, and Africa, as well as to offer them our own experiences. Our relationship with the World Health Organization will enable us to share knowledge and resources and align our goals and accountability. As WHO undergoes its reform process, we must ensure a strong connection with our headquarters through a commonality of goals and the sharing of global public health goods and resources. We are blessed today with new tools and technologies to help us listen, share, and communicate. Let's together explore new partnerships to use these evolving technologies such as the social media and e-health to engage with our stakeholders and constituents and to advance healthcare. To our member states, I pledge that we will be a responsible steward of the resources that you entrust us. We will be accountable and transparent. We will be fiscally responsible, and we will be results-driven. And every day, we will demonstrate our value in meeting the health priorities of our people. The Americas are united by a shared history and geography. We are blessed with great natural resources and a wealth of human capital. And we have a health agenda for the Americas that is ambitious yet achievable. With the transformational changes underway across our region, this is a moment for unity of vision and of recommitment to our mission. But I know that we cannot tolerate maternal mortality in our modern world. Every mother, every child, and every family must be cared for. I believe that we have the power to effect change in maternal and child health, in non-communicable diseases, in infectious diseases, in strengthening health systems, and achieving universal access. I thank you so much